fix the pipes, for instance. We have funded that water aid and poverty. And actually, if I would have if you hit it right on the nuts, you wouldn't think you this is good.
Okay, so. Okay.
You know what?
Okay, I think we can get going. Welcome everyone to this first session of UNC Water and Health 2023. Congratulations for being here on day one, session one. You get extra marks for that for sure. Today, I'm Rick Johnston from World Health Organization and Tom Slaymaker from UNICEF. Together, we're going to be presenting the findings from our most recent report, but we're also going to be taking a look under the hood to see where the data come from, how you can access the data, and how people can understand better, not just what the indicators are saying, but where those are coming from. This is a hybrid session. So we've got, I see about 20 people already online. Welcome to the online participants. There's also translation available online, continuous translation into French and Spanish. So please take advantage of that. And if you are joining us online, please feel free to type some questions into the Q&A. We have a couple sections where we'll be interacting more and asking for inputs from the floor in person, but also from the online audience. And you can also put comments and things into the chat. But if you have a question, the Q&A is the better place for that. So with that, let me get started. So the Joint Monitoring Program, the WHO-UNICEF Joint Monitoring Program, maintains global databases now on households and schools and healthcare facilities. And all of these are updated every 2 years. We've just published our households report last July, which means it's time for us to be preparing the reports on schools and healthcare facilities. So far, we've had 3 reports each for schools and healthcare facilities in the MDG and the SDG period. And in 2024, we'll put out our 4th ones. But today we're going to be focusing on households, though our data systems are very similar for households, schools, and healthcare facilities. So some of the tips and tricks that we'll work on today for households apply equally for schools and healthcare facilities. So we're going to roughly have about half an hour each for drinking water, sanitation, and hygiene and menstrual health. A little bit less time for hygiene, menstrual health. We'll see how we are going when we come up to the end of the hour. But for after each of those things, we want to have an interactive exercise to show you, again, where those data come from and how they're used to produce the estimates. Those exercises will work best if you have a laptop and are able to access our website. So I'm not seeing a lot of laptops in the room, but I hope some people have some. Unfortunately, our website is not very user-friendly on a portable, on a phone. But if you can log in online, we'll walk you through the website. Okay, so we will be talking, we'll be using as an example our 2023 report on Washington households, which had a special focus on gender. And before we get into the content of the report, you can go to the website there or use that QR code if you'd like to see the full report. Again, a focus on the data systems that underpin those reports. So this is the 4th report of households in the SDG period. And for each of our reports, we draw on more and more national sources of data. every country estimate that we produce is based on country data. We don't take any modeling to borrow information from neighboring countries or use covariates. It's all based on national sources of data. And in our last report, we had over 5,000, we used over 5,000 national sources of data. We had about 8,000, some of them we couldn't use for estimates. And you can see that a lot of them are censuses and household surveys, about half of them. But increasingly, we're drawing on data from routine administrative systems. And that might be a ministry's report, or it might be something coming out of the National Statistics Office, or a regulator, or Ministry of Environment, especially when it comes to information about the quality of services. What happens to the wastewater when it's flushed away from the house? What is the quality of water delivered to households? Routine administrative data are our preferred source for that type of information, whereas information on what types of infrastructure people are using, our preferred source is a household survey or a census, because people are quite able to tell you, what kind of toilet they use, what kind of drinking water source they're using. So there's been a nice progression. You see, we've got about 4,000 national data sources for drinking water and for sanitation. Far fewer for hygiene. We have, I think, about 269 for hygiene, almost completely coming from household surveys. You don't tend to see. Oh, I'm sorry. Did I do that? Maybe. Anyway, almost all of the data on hygiene, hand hygiene, come from household surveys. You don't see routine administrative data sets with information on how many households have water and soap in the home. And then on the far right, we've just started in our last two reports to collect and compile and report data on menstrual health. Again, this is coming exclusively from household surveys and is small now. We only have 61 data sets, but it's definitely a growing source of information. So then this is our website, washdata.org, and it has a data portal where you can interactively explore the data sets. And I encourage you to do that. I see more laptops coming out. That's great. We have separate data portals for household, schools, and healthcare facilities. And if you click on explore the data, you'll get to a landing page that looks kind of like this for households. And it shows some of the standard charts. We have ladder charts, we have progress charts, we have maps. The maps aren't very good. Sorry about that. But you see up there near the top, a download data button. And that is like a magic key to get to the downloads page where you can access Excel files that list and demonstrate all of the national data that we have in household, schools, and healthcare facilities, and also show the resulting estimates that we created from those national data sources. So I encourage you to look at this, and if you could download the Malawi country file, we'll be looking at that one as an example. For households, we have two types of country files. The standard country file focuses on the SDG indicators and the ladders that we'll be talking about. We also have inequalities files, and if time permits, we'll show you the more detailed disaggregations that are available on those. But the country files are really kind of the heart of our data systems, and they're also the way that we interact with countries. Every time we produce a global update, we first share the draft estimates with the countries for what we call a country consultation period. And we send them the Excel file, we send them a guidance note in different languages. These are facilitated through the WHO and UNICEF country offices. And what we're not asking is for countries to say, we have a different definition of this indicator, or we have a different method of calculating it, because as global custodians, we have to use one set of definitions and one set of methods for all countries. But what we are asking is three questions, actually. Are we missing any national data that we should be using, that we could be using to make better estimates? Second is, are we using any data that you don't consider reliable? Maybe there's a study that's not robust or not representative, or that the government doesn't consider as official data. Then we shouldn't use that. And the third is, have we misinterpreted anything? Because especially if national data aren't perfectly aligned with the global indicators, there's room for interpretation about, well, does this statistic match this global indicator or not? So any of those three questions, we could get feedback on during the consultation process and then finalize things before we go to publication. We give about 3 months for that consultation period. It usually starts in November. We're getting ready to start the consultation for schools and healthcare facilities in a couple weeks. And that gives us time to incorporate any feedback in the beginning of the year before publishing the reports, usually in June or July. Oh, and I see more and more people coming in online. Welcome. So I'm going to present some of the data on drinking water and then hand over to Tom to talk about sanitation, hygiene, and menstrual health. Of course, the target has all these words about achieving universal, equitable, safe, and affordable drinking water for all, especially this for all, the leave no one behind message of the SDGs. And the indicators to track this target build on the indicators from the MDGs. I think people are familiar with our ladders. In the MDG period, we also had ladders that only had 3 rungs. There are the people who were using no kind of facility at all, and that's reflected in our modern ladders. Those are people drinking surface water directly. There are also some technologies classified as unimproved, and that could be an unprotected well or an unprotected spring. We still track that today. But the MDG indicator of use of improved facilities, things like boreholes, tap water, things like that, we still use that classification, that technology classification, but add on to it service level elements to meet the higher demands of the SDGs. So if a household is using drinking water from an improved source, but it takes more than 30 minutes to go there and fetch water and bring it back into the house, that's now classified as a limited drinking water service. If it takes less than 30 minutes or 30 minutes or less, that would count as a basic drinking water service. But to reach the top level here, this safely managed drinking water, people should be drinking water from an improved source that's accessible on premises, where the water is actually available when needed, and it's free from fecal and priority chemical contamination. So there are these 3 new elements of safely managed services, and they all have to be met in order for a household to be classified as having safely managed drinking water services. So that's a much higher bar than the use of improved water supplies was in the MDG period. It's also worth noting that the basic level, it's basic, but it's also an SDG indicator in its own right. Under goal 1, the goal about poverty, it speaks. There's a target about making sure that everyone has access to at least basic services, and that includes basic drinking water, sanitation, and hygiene. So goal 1 as well as goal 6. And this graph is from a recent report, which shows the global and regional drinking water coverage, as well as trends between 2015 and 2022. On the world, on the right, you can see that the world increased from 69% safely managed in 2015 to 73% in 2022. So if you're a glass 3/4 full kind of person, you can take heart in knowing that almost 3/4 of the world has safely managed drinking water services in 2022. Of course, if you're a glass quarter empty, that means that's about 2.2 billion people who still lack safely managed drinking water in 2022. And that includes even about 703 million people who lack basic drinking water services. That's about 9% of the global population. And the people lacking basic services, this is really a phenomenon that's mostly in rural areas, 8 out of 10 people, and also primarily in the least developed countries, so-called least developed countries. Now, our report had a special focus on gender. So in each of our sections, we tried to highlight some data story related to gender. And it's difficult because most of the data that we draw on are not sex disaggregated. But one message of the report is you can have gender information without necessarily having sex disaggregated data, because some indicators have gendered impacts. And one of them, well, actually, I guess this one is sex disaggregated, is that we know from household surveys, in households that don't have water supplies on premises, someone has to go off premises and collect the water. Who is it? Well, in 2/3 of cases, it's women who do that. About 1/4 of cases, 26%, it's men who do it. If you take women and girls together, though, that's 70% of the households that have off-premises water, that collect water. That work is done by women and girls. So it's definitely disproportionately affecting women and girls. And that affects about 16% of the world. 1 in 6 people, 1.8 billion people live in households where they don't have water supply accessible on premises. It's interesting to see the regional distribution too. If you look at sub-Saharan Africa, Northern Africa, and Western Asia, similar story, 70% of the work is being done by women. But if you shift to Central and Southern Asia or Latin America and the Caribbean, you see that in some regions, it's actually men who are doing more of the water collection. However, there's a lot less water collection to be done. So in Latin America and Caribbean, it's only 3% of households that need to go collect water. So it's men who do it there. Thanks, man. Yeah. Yeah, well, it's, there are gendered aspects all throughout. So I would say that the water carriage story in the report is one of the strongest data examples we have of how gender and WASH intersect. And in many household surveys, we have data on who is responsible for collecting water. In a smaller amount of surveys, we also have information on how many trips that person took, how much time they spent per trip. And we're able to make this kind of analysis, which shows how many minutes per day are spent fetching water. Women and girls on the right, men and boys on the left. And here you can really see the inequalities where men do collect water, 5 minutes a day, maybe 7 minutes a day in some countries. But especially in sub-Saharan Africa, it's when water collection is taking 20 minutes, 30, 40, 50 minutes per day, on average, it's the women who are doing that work. It's also the girls to a lesser extent. But if you look at, let's see, whoa, no. Oh, no, my notes. Sorry, just a second. Yeah, in 11 countries, women and girls spent more than 5 times as much time collecting water per day as men and boys. So this is, yes. And the biggest inequality we found was in Malawi. Again, I said we were going to focus on Malawi. And in Malawi, in the average household, women and girls spent 52 minutes a day collecting water, and men and boys spent 3. Yeah. Also in Chad, girls spent 5 times as much time per day collecting water than boys. So I think this is one of the strongest analyses in the report, and I'm quite happy that we had a gender focus and we had enough data to tell an interesting story. Okay, coming back to the headline figure of safely managed drinking water, we did have data from 142 countries in this report. That's representing just over half the global population. You can see there are still a lot of gray countries on the map, though, many in sub-Saharan Africa where they just lack water quality data, especially. Often they'll have data on if water is accessible on premises and improved supplies, but water quality is really hard to get. China and India are interesting. In China, we have data from urban systems, but not rural. In India, we have data from rural systems, but not urban, so we can't say a national picture about either of them. We're hoping that in coming years, we'll be able to fill those data gaps. But I want to talk a little bit more about these 3 elements: accessible on premises, available when needed, and free from contamination. Now, sometimes those come from different data sources, so we can't say at the household level how many people have all 3 of them. So the way we get around that is we say, well, at the domain of the urban population or the rural population, which of those 3 elements is the lowest, has the lowest coverage? We call that the limiting factor, and we take that as the determining factor for safely managed drinking water. It's actually an overestimate in that case, because if you could really converge at the household, the situation would be worse, but because of data limitations, we can't always do that. So on the left, you see the number of countries that have estimates, and the different colors represent which of these factors was the limiting factor, which of them was lower than the others. And the first thing you can see is the height of the bars. Remember, there were 142 countries with national estimates. There are a smaller number that have rural and urban estimates. So on the right, we've just shown the proportion of all estimates and what the limiting factor is. And in about half of cases, it's drinking water quality, a little bit more than half in rural areas in particular. But it's interesting to see that in rural areas, more than 1/3 of the cases of the countries, it's actually having water accessible on premises that is much lower than drinking water quality. And in urban areas, 24%, 1 in 4 countries that has an estimate in urban areas is having water accessible when needed, available when needed. That's the limiting factor. So I want to zoom into some countries and show what kind of countries are facing these different challenges, because of course, the programmatic responses are going to be very different if you're talking about having water on premises versus available when needed or free from contamination. So water on premises. In these graphs, there are three of them. The vertical line there, that shows the population using improved water supplies. And then the three different shades and shapes show available when needed, accessible on premises, free from contamination. Here you can see free from accessible on premises on the left. And if we look at the rural areas, you can see that there's a lot of population that has improved water supplies. It's often available when needed. Even the quality is not bad, but having water on premises is just a huge barrier. And a lot of these countries are low-income countries. They're in sub-Saharan Africa. Again, look at Malawi, but also India, even some middle and high-income countries. Accessibility on premises is a bigger challenge than having water that's free from contamination. How about available when needed? We saw that more in urban areas, and it's a different type of country that's affected here. Very rare for that to be the limiting factor in rural, but here, look, we've got Costa Rica, South Africa, Montenegro, Algeria. These are not low-income countries. These are middle, upper-income countries where they've established pipe water systems. Everyone has improved water supplies. The quality is not bad. It's accessible on premises. It's just not always available when you do. And that's because of intermittent water supply and just urban areas being unable to keep up with the emerging demands of urbanization. So, water cuts. Then the last one, you see it in all kinds of settings, is drinking water quality. And the width of the bar between the circle there, freedom from contamination, and having improved water supplies is just vast. So if you look at, say, Tuvalu on the left, everyone in Tuvalu pretty much has improved water supplies that's accessible on premises, and it's all fecally contaminated, all but about 5%. So the message is that there's a huge gap between access to improved water supplies and safely managed drinking water sources, drinking water services. And it could be any of these three factors that are the limiting step for that. Okay, another graphic from our new report shows the coverage with safely managed drinking water on the x-axis, and then the rate of progress over the last 20 years on the y-axis. And you can see by combining those two bits of information that if your coverage now is high enough and your rate of progress is high enough, you would be on track to reach 100% by 2030, assuming historical rates of progress held. So we see Ireland in that category. We see a lot of countries that already have 95% coverage are likely to reach 100% by 2030 and meet the SDG ambition. You see other countries like Bhutan making great progress, over 2 percentage points per year increasing. But because they're still below 80%, that's not going to be enough to reach 100% by 2030. And then you see a lot more countries who are in the 1% range, or even getting worse, who are either not making fast enough progress or even seeing progress decreasing and won't meet the SDG target because of that. And if you sum those up to regional levels, you'll see that in none of the SDG regions is the rate of progress fast enough to reach 100% by 2030. At the global level, the rate would have to quintuple to reach safely managed services. Okay, now it's time for our interactive exercise. So those of you who have laptops with you, please get them out. And the quiz question is, we're going to go to that Malawi country file. We saw earlier that there's a lot of off-premises water in Malawi. Now I want to ask you guys, what does the JMP database, the SDG database, have to say about water quality in Malawi? What proportion of the improved drinking water sources in Malawi are free from contamination? And where did that information come from? So just as a reminder, you can find it by going to this page and clicking the download data button. And when you do that, you'll get a file that looks like this. This is the page again. And the file has a lot of tabs. I recommend going to the data summary tab because that lists all of the sources of data in rows. And then the columns will be things like improved water, piped water, free from contamination. And you can see which data sources have data on freedom from contamination. So I'll give you a couple minutes to work on that. And in the meantime, I'm going to see how the Q&A and the chat are coming. People online, you are also welcome to participate in this exercise. And maybe if you get the answer and you type it into the chat, you might be the first one to win the exercise. In the meantime, we do have one question about why we saw safely managed drinking water decreasing in Nepal. And we'd have to look at the country file to confirm, but I'm pretty sure it's because in Nepal, they've had a couple rounds of data collection on drinking water quality done through household surveys. And I believe the more recent survey showed a higher level of contamination than the first one, but we'll have to verify that. Are people able to access the websites? There's internet in the room. We'll also pause for a couple of reflections or questions or feedback once we give people a chance to explore the country file. So if you do have questions or would like to speak, let me ask you to come to the microphone so that people who are online could also hear your inputs.
And if you aren't connected to the Wi-Fi yet, it is UNC guest, and you have to sign in on your browser.
Are people finding the country file yet? Yes? Okay. Has anyone figured out what the source of data on water quality is yet? Malawi country file? Anyone? I was going to start calling on people. Let's see. Musa must have the country file open. Okay, well, I can hold your hand on this one a little bit, if you like. So when you open the country file, you see all these tabs. If you go to the data summary tab, you'll see a lot of data summarized. And each row here represents a national source of data, and each column represents an indicator or variable. And we group them into national, urban, and rural. This is the drinking water. The sanitation is off to the right. So some data sources have lots of numbers in them. That means that they have information on multiple indicators, whereas other ones might just have one or a few. The very bottom one there, the 2020 HFPS, only has information on availability when needed, for example. But if we look at free from contamination, the dark column to the right, we can see which data sources had some information on water quality, on freedom from contamination. So has anyone worked out which data sources we drew upon? The mix, yes. The 2020 mix near the bottom of the screen, it's fully populated. That means it has lots of data. And if you look at free from contamination, In rural areas, 40% of improved water supplies were free from contamination. And in urban areas, it was 69%. So the data summary tells you which data source we used. And if you click on the water data tab, you can see more information about it. So this is the mix on the right. We can see piped water, non-piped water, accessible on premises within 30 minutes. Further down below, you can see the detailed information from the survey. Was it piped water into the dwelling or into the yard or plot? What exactly was asked in the questionnaire, in the survey, and how we mapped it to the global indicators. But when you come up to the quality here, you see the microbial quality was the limiting factor here. You know, about, oh no, I'm sorry, accessibility on premises was the limiting factor, yes, in Malawi. So how did we get water quality data in a household survey? This is something that the JMP team has been working on for actually over 10 years now, in partnership with the mixed team supported at UNICEF headquarters. And back over 10 years ago, we started piloting in Bangladesh and Ghana to include water quality testing in a household survey by training the field teams to do membrane filtration and filter a 100 milliliter sample, put it on a growth plate that's specific to E. coli, incubate it for 24 hours, and read the results. And do this in a nationally representative survey, which might have 1,000, 5,000 households in it. And from that, you could get a nationally representative picture of the water quality in the country. This has really taken off now. There was a pause in 2022. Obviously, data collection went on hold for a little while, but it's back with a vengeance now. And there are at least a dozen, probably more like 15, 20 countries a year who are including this module in nationally representative household surveys. It's really started with mix, but now we're also seeing it in the demographic and health surveys and other national surveys. So this has led to a lot of countries being able to establish their first SEG baselines. And because it's done in the context of a household survey, you can also find out a lot of detailed socioeconomic information, like describing who is having better or worse quality of water. What type of water supplies are they using? What is their sanitation like? What's their wealth like? What part of the country do they live in? So it's a very rich source of data. We've explored some of the learnings from it on our website here in that publication you can see there. So before we're going to turn to sanitation next, I just wanted to see if anyone had any feedback or questions or comments related to the monitoring of safely managed drinking water, the findings, the gender implications, the country files. No, go ahead.
Hi, this is
Hi,
this is Nuhu from ICT. My question is the definition of available when it's needed for the water. So can you describe it? Because for a compound or household, availability definitely not, it should be 24/7. So how you define that?
Thanks. That's a great question. And actually, this is one of the ones that's most tricky to define and measure. E. coli, maybe it's hard to measure, but it's clear to define. So for availability when needed, we can use data that comes from administrative systems, but it doesn't have to be continuous 24/7. There's not a global benchmark about volumes or hours per day that would be adequate. So what we use in the absence of that is just most of the time, which could mean more than half of the hours in a day, 12 or more hours, or more than half of the days in a week, 4 days a week at least. But our preferred way to get data is to include a question in a household survey that asks people, has there been any time in the last month when you didn't have enough water to meet your daily needs? And that's deliberately subjective because the actual amount of water that a family will need will depend on how many people are in the family, what the cuisine and the culture and the temperature is like. So we prefer that than something where you try to measure, do you have 55 liters per capita per day in the house or not? And that is a standard question now in most mix and DHS surveys. So that's where we prefer to get most of our data. Okay.
Thank you.
Can I shout when you?
Yeah, yeah.
there? So great. I mean, these data are amazing, right? It's finally pushing forward there. One of the things that I'm working on, I'll talk to others. How do we translate that into action, right? So one of the challenges that we're facing is overwhelming data coming in. And then what are we going to do to disseminate that into those very succinct approaches that would allow someone in the ground to say, this is where I need to focus, and how are we going to go forward with that?
Yeah, how the whole data to action question, it's the big question.
Yeah.
In a sense, it's more your job than our job. Our job is to make the data available to you and to show you how you can get the more detailed data that you can use for advocacy. But I know there are a lot of people in this room who are already using that, who've changed programmatic approaches to align with the new ambition of the SDGs about bringing water closer to the home, or if not on premises, at least within 30 minutes, to consider more seriously water quality and availability. So I don't have a quick answer for you, but like having better access to the data and being informed by it is how we hope to see that change effective.
Giving countries, champion countries, that ability to say, this is what worked for us, or others that this didn't, really might be a way to go forward. I know it's not.
Well, one thing we do in our reports is we always try to shout out to countries that have done something remarkable. So, you know, our headline figures are about 73% of the world, but then we do like to show this country has done really something amazing and could be an inspiration to others. Okay, I'm going to pass on to Tom for sanitation, but if you do have other questions or comments on drinking water or sanitation, pop them in the Q&A, pop them in the chat. Thanks.
Okay, thanks, Rick. I'm Tom Slaymaker. I manage the UNICEF side of the Joint Monitoring Programme. And I'll pick up where Rick left off and talk you through what we have in the report, some of the highlights around gender and sanitation, but also, again, looking underneath, trying to understand where these data are coming from. One of the things we find in our discussions with different, wash sector organizations and conferences, but also in our country missions, is people are very familiar with the headline figures, but they don't necessarily understand how they've been constructed. So we're very keen to make sure that there is a broad awareness of how the estimates are produced. Firstly, so that we can get feedback on whether they are in fact the best possible estimates or whether they can be improved, but also to be able to explain to others when questions come up. So we have our target, 6.2, and here we have by 2030 achieve access to adequate and equitable sanitation. There's also a reference to hygiene, which we'll come back to, but I also wanted to highlight open defecation is explicitly referenced in the target. And then we have the JMP ladders. I think many of you will be very familiar with these. Again, we're building on the old MDG classification of improved and unimproved facility types on the left-hand side there. But now for SDG monitoring, those who are using improved sanitation facilities are divided into three categories. So we already have improved sanitation facilities that are shared with other households. We call that a limited service. If it's improved and not shared, it counts as a basic service. But the challenge at the top of the ladder here is safely managed sanitation. And here we're applying additional criteria for safe management of the waste produced. And you can see a little cartoon on the right-hand side here, illustrating the three possible routes to safely managed sanitation. So one is if you have a sewer connection and the waste is then transported through a sewer to a wastewater treatment plant, that will count as safely managed. So that's the top one, wastewater treated off-site. But it's much more complicated where we have on-site sanitation, and here we have these two options. So one is where you have a septic tank or a pit latrine or some other improved sanitation facility. The waste may be contained and treated in situ. That can count as safely managed. But in many cases, those on-site facilities are being emptied, the waste is being removed, and then it would need to be treated off-site. And so that's the third possible route here, excreta treated, emptied and treated off-site. So we'll try to look at each of those three routes and show you where the data are coming from. In terms of our last report, these are our ladders. We produce these for regions and also for the world. You can see the trends between 2015 and 2022. And you can see Our global estimates on the right-hand side here, showing that coverage of safely managed sanitation has increased from 49% to 57% over that period. This means that globally, we still have around 3.5 billion people lacking safely managed sanitation in 2022. And that includes about 1.5 billion lacking a basic sanitation service, and among those, 419 million still practicing open defecation. And you can see that we have estimates for almost all of our SDG regions. 7 out of 8 have sufficient data to produce estimates for all rungs on the ladder. You can see there's a huge variation in coverage from just 24%, I think, in sub-Saharan Africa through to over 96% in Australia and New Zealand. But you can also see on the right-hand side here, if we look at current trajectories, we can calculate where we will be by 2030 if current rates of progress continue, and also the acceleration required. So you can see globally that we are almost on track to eliminate open defecation, just a one-time acceleration required. But to achieve universal basic, that would require a doubling of current rates of progress, and achieving universal coverage of safely managed would effectively require a 5-fold increase in the current global rate of progress. So in the report, you'll see the different sections of the report. We have drinking water, sanitation, and hygiene. And in each section, as Rick mentioned, we have a section on gender. And so when it came to analysing gender aspects of sanitation, this is quite challenging, but one of the issues that came through very strongly was around shared sanitation facilities. Now, of course, these are a really important interim solution when individual household facilities are not feasible, but we also know that they very frequently do not meet the needs of women and girls due to concerns around accessibility, around cleanliness, privacy, safety, and so on. So in the report, we wanted to highlight that we still have 570 million people using improved facilities that were shared with other households. About 3 out of 5 of those are in urban areas. So the map here is showing the 33 countries where we still have more than 1 in 4 people in urban areas using shared sanitation. You can see that many of those are in sub-Saharan Africa. And I think in 2022, we had about 1 in 5 people using limited services in sub-Saharan Africa, compared with about 1 in 10 in Central and Southern Asia. It's about 1 in 20 in Oceania. Another interesting piece of data that we highlighted in the report is the multiple indicator cluster surveys that Rick mentioned. Ask this question to both women and men about how safe they feel walking alone in their neighborhood after dark. And because those surveys also include information about the type of sanitation facilities that people are using, we can analyze for those with shared sanitation, are men or are women more or less likely to feel safe walking alone after dark. And you can see quite clearly in the chart on the right-hand side here that men on the x-axis are much more likely to feel safe than women. You would expect that. But you can also see that we have a much smaller proportion who feel very unsafe. And again, women are much more likely to feel very unsafe than men. And we highlighted some examples here where we have quite big differences. So, for example, in Georgia, I think 85% of men, but only 47% of women. In Belarus, 59% of men, just 13% of women feel unsafe walking alone in the neighborhood after dark. We also know that open defecation disproportionately affects women and girls. Much less likely to be able to maintain privacy, dignity, much more likely to face physical, sexual, or verbal assaults than men or boys. And so in the report, we highlighted the 36 countries with open defecation rates between 5 and 25%. And there are 13 where we still have more than 1 in 4 people practicing open defecation, almost all of those in sub-Saharan Africa. And we've got 3 countries, so Chad, Niger, South Sudan, where we still have over 60% the population practicing open defecation. So we can expect that gender-related inequalities gender inequalities related to open defecation are likely to be most acute in these countries. So coming back to safely managed sanitation, we had estimates for 135 countries in the last report. That means they had sufficient data for us to be able to make a national estimate. And what we find is that we have many countries which have information on wastewater treatment, especially in the high and middle income countries, but relatively few that have information on safe management of on-site sanitation. And so in order to produce a national estimate, we have to be able to have information on the dominant type of sanitation in that country. And you can see here on the map, we have some countries marked in gray, where there is insufficient data available. That basically means we don't have information about safe management of the dominant type of sanitation for that country. Really important thing to understand when we're looking at safely managed sanitation is that we first need to understand the balance between on-site and sewage. So globally, and this is not from our last report, but from the one before, but we have roughly equal proportions using on-site and sewage sanitation. So it's about 43% in this chart. You can also see that in urban, as you would expect, sewage is much more likely to be the dominant type, and in rural, on-site, in the light green, is likely to dominate. But there are really important differences across the different regions. And so you can see that in particular, in sub-Saharan Africa, in Central and Southern Asia, the dominant type of sanitation is on-site sanitation, and that will remain the case for some time to come, especially in least developed countries. I think it's nearly half of the population using on-site sanitation, just 4% using sewer connections. In sub-Saharan Africa, I think we have, even in urban areas, only about 16% having sewer connections in 2020. So this has really important implications when it comes to thinking about the routes to safely managed sanitation in different parts of the world. And we try to analyze in our reports the sort of patterns that emerge from the data that are available. So when it comes to the on-site sanitation systems, if they provide effective containment and they have never been emptied, then we can consider them safely managed. Okay, so when a pit latrine or a tank oh, sorry, can I go back? Yes, something happened to my slide there. So a pit latrine or a septic tank that has never been emptied, if we consider the waste to be effectively contained in that pit or in that tank, then we count it as safely managed. In recent years, we've had a number of household surveys which have been including questions asking households whether their facilities have ever been emptied. So on the left-hand side here, you can see the proportion of the population reporting that their on-site sanitation facilities have never been emptied. And you can see that on the x-axis, we have urban, and on the y-axis, we have rural. You can also see that we have different symbols for the septic tanks and for the pit latrines. And what you see immediately is that emptying is much more common in urban than it is in rural, and that septic tanks are more likely to be emptied than pit latrines. This might not surprise you, but it's shown very clearly in the data. And then the second chart on the right-hand side is showing the proportion of facilities which have been emptied, which have then either been removed off-site have been removed off-site in rural and have been removed off-site in urban. And again, you'll see they're much more likely to be not only emptied, but also removed off-site in urban areas. So again, we try to follow the data, we try to understand what is happening to the waste from these facilities, and we know that the majority of waste that is being emptied and treated off-site is in urban areas. When it comes to wastewater, we have data for quite a large number of countries now. We know the proportion of the population with sewer connections, and we have information on the proportion of waste water which is receiving treatment. And so if the waste is receiving at least a secondary level of treatment, then we would consider that to be safely managed. There are some cases where there is a primary level of treatment and there is a long ocean outfall, which means there is no risk of human contact. That could also be counted as safely managed, but those examples are very few and far between. But what this chart is showing you is that the proportion with sewer connections is generally higher than the proportion with wastewater treated, and so wastewater treatment is not keeping up with sewer connections. You can see the example of the Netherlands there. I think almost universal sewer connections, nearly all of those are safely managed. But Puerto Rico, lower down, you can see again, very high proportion of sewer connections, but only about a third of the wastewater is actually being treated. And then looking at the fecal sludge, again, we have the data from household surveys looking at the proportion of households who are reporting emptying, and then we have the two types. So we have those that are emptying and burying on site on the x-axis, and those that are emptying and removing off-site on the y-axis. And you can see different patterns for different countries. And you can also see different patterns for septic tanks and for latrines. So here, in the bottom right, you can see, for example, in Bangladesh, Guyana, Zimbabwe, the dominant practice is to empty and bury on site. And that we would consider safely managed. But in Thailand, at the opposite end of the chart, we can see the vast majority, 95% of households with septic tanks have reported that they have been emptied. And so we want to know what's happening to the waste from those that have been emptied. We do have some examples here, Vietnam and Serbia, which are a long way away from the line. That means that the waste has neither been buried on site, nor has it been removed for treatment. It means it's going somewhere else. And if we look at the data for those countries, we find that a large proportion of the waste is being deposited in uncovered pits, open ground, water bodies, and none of those would be counted as safely managed in the JMP estimates. So this is going back to our butterfly chart showing you on-site and sewered sanitation for rural and for urban and for total, for the world and for the different regions. And what we're showing on this chart is the on-site sanitation is on the left-hand side, the sewered sanitation is on the right-hand side. And you can see in light green, the type of sanitation that people are using, and in the dark green, the proportion which are in fact safely managed. And so globally, as I mentioned, we have much more sewered sanitation in urban than in rural. And you can see from the chart here that the patterns vary across different regions of the world, particularly in sub-Saharan Africa and Central and Southern Asia. We see that on-site is more dominant. And one interesting thing that you will see here is that on-site sanitation is more likely to be safely managed in rural areas than it is in urban areas. And that is because if you have a simple pit latrine and when it fills up, you simply cover it over and dig another one, or you empty it and bury it on site, that counts as safely managed. That method is very difficult to use in an urban area. And in urban areas, the on-site sanitation facilities are being emptied, and we need information on what is happening to that waste and whether it's being safely treated. So there's a lot of detail behind the estimates that we put in the report. We are increasingly able to estimate trends in safely managed services. This is the same chart that Rick showed with coverage along the x-axis and annual rates of change along the y-axis. You can see we highlighted China there, has recorded one of the fastest annual rates of progress. amongst upper and middle income countries, over 2% percentage points per year. But even at that rate of progress, it's not sufficient to achieve universal coverage by 2030. So what we're trying to do here is just to show what are the status, what are the trends, and what are the prospects for achieving different targets by 2030. We can do that globally, but we can also do it for each of the regions of the world. And so on the chart on the right-hand side, you can see at current rates of progress, safely managed sanitation coverage will be about 65% in 2030 globally. You can see that Central and Southern Asia has made one of the fastest rates of progress over the last 20 years. You can see that progress in sub-Saharan Africa is much slower. And so these are interesting patterns that we see in the data, and they'll help us to draw conclusions about where the effort needs to be and the types of policy responses that we need in order to address the challenges. So I think we're going to go and do another exercise now. So this time we're going to take you to the website. And what we would like you to do is to pull up the website, WASH data, and have a look at low-income countries and try to figure out which of those low-income countries had the highest national coverage of safely managed sanitation services in 2022. And once you've done that, there's a second question, which is to try and figure out how much of this is coming from wastewater treated offsite, how much is coming from fecal sludge treated offsite, and how much is coming from on-site sanitation treated in situ. Just as a reminder, you go to the website, you get to the splash page, you can see you get some default charts. But if you click on create a chart, you can then make your own, and you can edit the charts, and you can decide which countries, which variables you want to select. So for this one, we're going to create a rank chart. We're going to rank low-income countries, and we're going to look at sanitation. So if you click through, you should see something like this. The default is to show all countries of the world. You can use the filters on the left-hand side here. You can select the region that you want to look at. So the region type will be low-income countries. And then you can select whether you want to see coverage, population. You can select the ladder type. Lots of different pieces of information that you can pull. So these are the questions. Give you a few minutes. See if you can come up with the answer.
That's it. You could respond to that. Okay. Did you want to talk about the website? Well, maybe once people have just control out. Yeah. While you're doing that, I can just confirm the response I made earlier about Nepal. There have been 2 rounds of mixed surveys. In 2014, the survey found 30% of improved water supplies were free from contamination. And in 2019, the update survey found only 25%. So that's the reason we see a negative trend in safely managed drinking water in Nepal. But it is important also to recognize that when we have so few data points for some elements of safely managed, the numbers can change pretty quickly from one report to another. We have tons of data about improved water supplies. So if you get a new data point that shows a different level of improved, it won't change the estimates very much because we use linear regression with all the points. But when you only have 1 or 2 data points, say for drinking water quality, a new data source can make a huge difference.
So what about natural disasters or conflicts in that about these data, right? Nepal had an earthquake and then we've got other ones going on there. How is that put, is that put in at all? It's gonna go down a bit into the scope there.
Yeah, it's a good question. And in fact, there's a chat from the virtual participants asking about Sudan and asking, do we have data on the latest situation in Sudan? We rely on official sources of data. So in cases where data have been collected, since a natural disaster or since a conflict, then we can start to see whether there is a change in the situation and whether that's affecting our trends. But in many countries where we don't yet have data, new data available, it won't be reflected in our estimates, and that is a real challenge. Sudan's a good case in point. We don't have any data since the conflict. But in countries with natural disasters, we do quite often see new data sources coming through after the event, and we add those to the country file and we take them into account in terms of our estimates. We have also tried to look at progress since the pandemic. People ask us very often, do you see any improvement as a result of the response to COVID? And we do see in some countries that there has been an uptick in, particularly in hygiene. But in many cases, if we only have 1 or 2 data points since 2021, it's very difficult to say conclusively whether it's a trend, but also whether it will be sustained or whether things will go back to how they were before. How are we getting on with our exercise? Has anybody come up with the answer to our questions? Yes, Lisa.
Showing 61.13. If I try to look for the low and middle income country that has got the highest national coverage, what I'm seeing is the Laos People's Republic, Democratic Republic, which is showing 61.13.
Which indicator are you looking at?
I'm looking at safely managed.
Sanitation.
Yes. Household sanitation 2022. Sorry. Oh, sorry. My apologies. Household data sanitation 2022.
Now, Musa is showing the least developed countries, which are different from the World Bank income classification of low, middle, upper middle, and high income countries. So if you try the region type, not least developed countries, but income, then you'll be able to select the low income countries.
Thank you.
Any other comments or feedbacks about interacting with the site? Oh, that sounded good. I like that sound. Wait. Okay, I hear someone has an answer over here.
Malawi.
Malawi?
Yeah, Malawi.
Tom, is Malawi the correct answer?
Well, it would be if I could make the slides there. Yes.
Yay.
Well done. Well done. All right. So among the low income countries, Malawi had the highest rate of safely managed sanitation in 2022, 46% of the population. So you can see here, selected low income region, we've selected sanitation, we've selected total rather than rural or urban, and we've ticked just show me safely managed on a ladder. Now that might surprise you to see that Malawi has the highest rate. This is just amongst the lower income countries though. Has anybody come up with the answer to the second question? So the second question was how much of this comes from wastewater treated off-site, how much from fecal sludge treated off-site, and how much from on-site sanitation treated in situ? Yes, please. There's an answer over here.
And the 45%, 74% is disposed in situ, and the remaining 0.45% is fecal sludge. Is
That's
it?
right.
Yeah.
That's great. Okay, so here we have our ladder, but instead of analyzing by service levels, we're analyzing by safely managed criteria. You can tick the 3 possible routes to safely managed, safely disposed in situ, fecal sludge treated, and sewage treated. You can see here for Malawi that you have almost all of them, 46% are coming from safe disposal in situ. This is because in Malawi, about 76% of the population uses improved latrines. It's only about 2%, 3% with septic tanks, maybe 1% or 2% with sewers. And we also know from the surveys that over 95% of them have never been emptied. Okay. And so in terms of our estimates, we count those as safely managed. However, we are making an assumption here about containment, and this is really important. So if we don't have any data about whether or not those on-site facilities are containing the waste, we will assume that all of the latrines are containing the waste and 50% of the septic tanks are containing the waste. Now, we do that because we know that in many cases, septic tanks have a lot of problems. There's a lot more water. There's a lot of risk of waste spilling out and creating a risk to the users. That is much less likely to happen with latrines. However, these are assumptions which we make when we don't have any data. So what we really want is to have some data on containment. And that's something that we've been working on, along with other aspects of measuring and monitoring safe management of on-site sanitation. We've had this project called SMOS, which has been running for a few years now, and we had an initial 6 countries in phase 1, Bangladesh, Ecuador, Indonesia, Kenya, Serbia, and Zambia. And we're now moving into a second phase with another 5 countries. And the purpose of this project is to try and figure out how to measure and monitor containment, emptying, treatment, and disposal of waste from on-site sanitation. And so you'll see there's a synthesis report there summarizing the lessons from phase 1. There are also some reports from those phase 1 pilots on the website, and we're now developing some guidance on how these things can be done based on the experience from the pilot countries. What we found is that you can't collect all of this information from a single data source. You can collect some information from a household survey, but households can't tell you everything you need to know about sanitation facilities. And so you're going to need some sort of sanitary inspection, but also you're going to need information from service providers and from local authorities about what is happening to the waste that has been removed for treatment. Where does it go? And is it actually receiving treatment? What type of treatment? What level of treatment? So in order to calculate safe management of on-site sanitation, we need multiple different pieces of information for a given country in order to come up with robust estimates. So we have some tools here. We also have the Bangladesh team in the room who led one of the phase 1 pilots and have lots of great experience on trying to do this at a national level. Can I just open up and see if there are any more questions on sanitation before we move to hygiene and menstrual health? Yes, please. Can we? Thank you. Just so the people online can hear you.
include, especially the on-site disposal, does it include data around what's happening with the surrounding water bodies as far as nutrient removal and pathogen removal? Just curious in terms of both human health being contaminated, water contamination from on-site disposal.
Yeah, great question. So that is not part of the definition for SDG 6.2 for safely managed sanitation. So we are primarily interested in whether the sanitation facility is creating a risk to the users themselves. And that has been the main focus of the indicator and also the tools that are designed to measure it. For 6.3, which is about safe treatment of wastewater, there is a lot more attention to not only is the waste being treated, but what is the quality of the effluent, which is then discharged into the environment? Is it meeting standards? But that is a separate indicator which is actually measured and monitored by WHO. There is a lot of interest in whether or not on-site sanitation is causing a risk to groundwater. As it stands, we don't have a robust way of measuring and monitoring that. And that's a really big challenge. So we're not saying it's not an important issue, but we are saying that most countries, especially low and middle income countries, don't have a very good way of measuring that at the moment. So that's something that I think we need to continue working on.
Okay. My name is Uttam Kumar Saha. I am from Practical Action, Bangladesh Country Office. Yeah. In terms of the gender and sanitation, what I learned that most of the focus are around the participation of women in the community toilet in urban areas. So most of the information, but actually in terms of the on-site or off-site safely managed sanitation, do you think that other indicators are also required? Like who are actually taking the decision of the emptying services, or like how many sanitation workers are female and how they are filling that? So those type of indicators, do you have any plan for future addressing this indicator into the sanitation part? Yeah.
A great question. Thank you very much. So in the report that came out in July, what we tried to do was to analyze existing data on gender inequalities in relation to water, sanitation, hygiene, and menstrual health. And what we found is there are very limited data available. And it's especially challenging to compare across countries. So we focused on those indicators that already exist that could compare across countries. But the JMP has had an extensive review of emerging indicators and tools that could be used for enhanced monitoring of gender and WASH. So we produced a report which is on the website. It's also described in the update, and in there you'll find a much longer list of potential indicators that could be used to measure and monitor different aspects of gender and sanitation. So absolutely, there are many other important elements that can and should be considered. But at the moment, those are not being systematically monitored. And so that's why we couldn't include them in the report. So I think what we will try to do is to then pilot test those new indicators over the next few years so that some of those could potentially be included in whatever framework replaces the current SDGs. But I'd really recommend you look at the gender review if you're interested.
Just about the climate and seasonality data. For example, the septic tank functionality or like dislodging practices, very much depending on the flooding and other events. So how this data will address that?
Yeah. Should we take that other question at the back as well? Is that possible?
Hi, I wanted to ask, what is the definition of or parameters of on-site sanitation? And I'm asking this because in as much as I'm from South Africa, in as much as there's a lot of communities that prefer VIPs for access, we find that that poses a whole lot of safety risks for children who, in terms of the actual pit latrine or VIP itself, it's not safe for physical safety, but also health-wise. So it works for access in many instances, but it's not safe enough for people to use it. So I'm wondering if there is sort of like a prerequisite of, if there is an on-site sanitation that is probably helpful for managing the waste, what should that look like to make sure that it's safe, or guidelines of some sort? Because a lot of people in our context don't want it anymore for the other reasons that are related to it, where we've had children falling on the pits, we've had other health implications, but also some environmental impact as a result of the on-site sanitation that is stored within the premises. So it'd be interesting if there is, I know it might not be something you've looked at, but it'd be interesting to know, what is a healthy, I don't know if there's a word for that, but is there a guideline, or is there a definition of what a good on-site sanitation should look like?
Thank you. One more at the back.
There's two more, and then we need to close the
Yeah.
questioning, I think.
Hi, Manishka Eliatambi with Iris Group. I was wondering, are we only looking at fecal sludge management as safely managed sanitation, or are we also looking at management of menstrual waste, which contributes to about 20% of source water contamination?
Hello, my name is Anurag Anthony. I'm from Urban Management Center. We're based in India, and we've been working in water sanitation for a long time. And I have two specific questions. The first one is that JMP is supposed to and has been influencing national policies across the world when it comes to water sanitation. But as of now, I am not sure to what extent the reliability of data is being considered in the reporting, and hence a much more accurate national policy is being informed. If JMP has a plan for reliability, is there a way that we can access it and contribute to it? We'd love to do that. So that's the first question. My second question is that I'm happy to see the progress that you projected both in water and sanitation the world is making, which is great. I am overwhelmed by the amount of data and the possibilities that it creates, but I'm underwhelmed by the gender disaggregated data. And partly the question was asked by the gentleman from Bangladesh, but does JMP have a plan or a framework where you have listed certain areas where gender disaggregated data can be collected and how it can be contextualized based on each country? And if yes, we'd be more than happy to contribute it if we can have access to it.
Okay, all very good questions. Thank you. So I'll try to answer the first two together. So you talked about seasonality and flooding and how that's impacting on safely managed. And then the question from South Africa was about, going beyond the kind of basic indicators and taking into account other elements. So I think for safely managed sanitation, we're starting to take into account, are the wastes being effectively contained? Are they being emptied? If they're being emptied, where are they being emptied to? A lot of that requires some sort of inspection of the facility, and that opens up the opportunity to look at a range of different things. In a household survey, we might have some very simple information about the type of technology, but it doesn't tell us anything about whether it's functioning, whether it's broken, overflowing, flooding, or whatever. So I think this is what we're moving towards. And I think there are two different ways of doing that, which have emerged from the SMOS study. One is a full sanitation inspection. So there are WHO guidance on this, and it looks at a range of different issues that are going to be very important. And the other is to do a much lighter version of that on a more regular basis, to just try to capture whether or not facilities are usable, or whether as a result of a flood or some other event, they have become unusable and are creating a risk to the households. So those would be two very important emerging sources of data that we will start to use on containment. The question on menstrual waste, we don't currently have a way of measuring and monitoring that, but I think it's a very interesting question. So I'd be very happy to talk about it. But no, it's not part of the definition because we don't have a way of measuring it. And then on the urban question in India, for all of our estimates, we are relying on national data sources. We use, as Rick said, a combination of censuses, surveys, administrative data. So administrative data may include sectoral management information systems produced by ministries, but also regulatory data is increasingly important. So there are a range of different sources, but in all cases, we will defer to the government to tell us which are considered the official national data sources, which can be used for reporting. And in particular, we will defer to the National Statistical Office. Now, the National Statistics Office is normally a sort of independent body within government, which will decide whether or not the data are robust, statistically representative of the entire population. So that is a big part of our country consultation, trying to figure out which are the reliable data sources, which ones can be used, which ones should not be used for different reasons. But ultimately, it is the NSO that will decide. That is the way the UN system is working. But thank you for raising the question of the gender indicators. So as a result of the review and also the report, we are now moving towards publishing a sort of list of priority indicators that we would like to promote, and we would like to see governments taking up and integrating into national monitoring systems. There was a consultation on a draft list that happened in September, and I think that the final list will be published in the next couple of months. And we hope that we can then use those as a focus for discussions on how we can improve monitoring of gender and WASH going forward.
And just on that gender point, a lot of this work that we've been doing on gender has been done in collaboration with Emory University. And there are some folks from Emory here today, and there are some other sessions during the week about that work as well that get into more detail. So I encourage you to follow up on the work that Emory's been doing around monitoring gender and WASH.
Right. So last but not least, moving on to hygiene, which is referenced in SDG target 6.2. But also we have this explicit reference to paying special attention to the needs of women and girls. And so in JMP reports, we have started to compile and report data on menstrual health, which is a very important element of SDG 6.2. The ladder for hygiene, which I'm sure you're familiar with, is much simpler than the ladders for drinking water and for sanitation. It only has 3 rungs. There is no safely managed hygiene, at least not yet. This is partly because we've only been measuring and monitoring progress on hygiene since 2015, when it was included in the SDG framework. And so we have far fewer data points to work with. But a basic hygiene service means households have a hand washing facility with soap and water available at the time of the survey. If there's a facility available, but it's lacking water or soap, it's a limited service. And of course, we still have significant numbers of people with no facility at all. In our last report, we had estimates for 84 countries. So it's been increasing slowly, but we still primarily have data for low and middle income countries. One of the big challenges is getting data on hand hygiene for middle income and high income countries, which don't tend to collect this information. There is a general assumption that everybody has hand washing facilities and everybody is washing their hands. We do not accept that assumption when governments suggest that we should just assume that everything is fine. And so we leave large parts of the map in grey. However, we are interested to explore other potential indicators, proxy indicators that can be used for high-income countries. For example, whether or not households have a bathroom, whether they have running water in the house, etc., which could be used as a reasonable proxy. You can see that we as a result, are only able to make estimates for 3 of our SDG regions. And we have partial estimates. So we have old data for Northern Africa and Western Asia, and we only have recent data available for Eastern and Southeastern Asia, which means we're not able to calculate robust trends. We actually have much better data for least developed countries and low-income countries. And so we're reasonably confident of those trends. But we have to be very careful, I think, when we're looking at the global trends and the regional trends and trajectories for hygiene, because we still only have a relatively small number of data points. In the report, we really struggled to find data on gender aspects of hygiene. We know that the burden associated with not having hand washing facilities is bound to be disproportionately high for women and girls, especially in countries where they are primarily responsible for childcare and domestic chores. I think that's reasonable to point out, and we highlighted it in the report. But we have very few studies which have sex disaggregated data, and so we had a small number of studies from high-income countries which we highlighted, and here they're asking people about their practices in public restrooms, public bathrooms. So it could be in universities or transport hubs or museums. There are a number of different studies available, and there are 2 types. So there are those which are reported and those which are observed. And that's also interesting. But what you see consistently is that across the board, women are more likely to report washing their hands, and they're also more likely to be observed washing their hands than men. But there are also some very big differences between reported and observed, and that's worth highlighting because it shows that simply relying on reported hand washing behavior is not a very reliable indicator for global monitoring. So these were some interesting data that we highlighted in the report. We also included some emerging information about the availability of a bath or shower within the dwelling. This is something which is not yet standardized, but is a potentially important measure of hygiene above and beyond hand washing, and is also something that was highlighted in the gender review that Emory University led on, that there are gender-related inequalities linked to the ability of women and girls to meet their needs through having bathing facilities at home. So that is something that could potentially be added in future. But when it comes to menstrual health, we have 4 core indicators that have been included systematically since about 2016, 2017, when they were adopted. Menstrual health indicators are sex specific, they are highly gender relevant, and so they do provide a useful measure of gender related inequalities. They're covering both sanitation and hygiene related needs of women and girls. But there are a whole range of issues here that are not captured in the existing indicators. So in our report, in our last report, you can see that by 2022, I think we had nationally representative data on menstrual health for about 53 countries, which is really good. That's been steadily increasing over time. The majority had information on the use of materials and on whether women and girls had a private place to wash and change. A smaller number of countries had data on participation in activities during menstruation, and a very small number, just 2 countries, had data on awareness of menstruation before menarche. So we highlighted those in the report, and we discussed the importance of these indicators, but we also highlighted the fact that there are new indicators coming through now, which will start to provide a better measure. If you look at the indicators together, this is one of the charts from the report. It shows that coverage of use of materials and a private place to wash and change is quite high across many of these countries. It suggests it's not a very sensitive indicator. You can see that participation is slightly lower than use of materials and a private place to wash and change. That's interesting. But you can also see, and these are the circles which are not filled in, that when you look at all of these elements together, the proportion of women and girls meeting all of these criteria is significantly lower than for the individual criteria alone. So I think these indicators are still evolving, and we're proposing to add some new ones in future. I'll talk about those a little bit after the exercise, but we also wanted to just highlight the data that we have available on inequalities in hygiene and menstrual health, and to do that by looking at the inequalities files. So here is the exercise. Rick, why don't you go talk us through this?
Well, actually, Tom, our time is up. So I'm just going to show you the exercise that we wanted to do together. I think people now are a little bit familiar with the Excel files of our country files, but maybe are less familiar with the inequalities files. And what these do is you can download them in the same place, but they show many more variables disaggregated by wealth quintile and also by subnational region. So if you would look at the Bangladesh one, when you have more time for inequalities, you would see it has a bunch of different surveys, maybe 6 or 7 surveys where we have the raw data and we can calculate wealth quintiles and show a lot of variables and how they vary by wealth. If you would go to the Mix 2019 tab, you would see the water area where there's not a big wealth gradient by wealth because almost everyone has improved water supplies in Bangladesh, even in the poorest quintile. But for some of the variables, there will be interesting wealth gradients that you could explore. These buttons help to navigate around. If you would click on hygiene, you would see that there's quite a big wealth trend where in the poorest quintile at the national level, only 31% of households had basic hygiene services, whereas in the richest, it was 86%, so more than double. So the country files or the inequalities files have those wealth quintiles. They also disaggregate by subnational area. So you could see different divisions within Bangladesh. What were the different levels of coverage? If you would scroll down or click the button MHH for menstrual health and hygiene, you would be able to see that there are important wealth differences in both the type of facilities, the type of menstrual materials that women and girls use, whether they're reusable or not, and also important urban and rural differences. I encourage you to look at that more over time. I just wanted to flash 2 slides quickly. You won't have time to see them, but there's been a lot of progress in menstrual health and measurement over the past 5 years. And in fact, there's been a recommendation for an additional set of indicators to move beyond those 4 that Tom highlighted. And here's a list of them. These are now incorporated in some of the standard household surveys like Mix. So we think that over coming years, we will get more and richer indicators about menstrual health, but this is still an emerging area. And I think we'll also see further refinements about measuring and monitoring menstrual health in coming years. So I'm sorry we didn't have more time. Sorry?
Shows what they are. Yeah.
This is it. Yeah. So on our website, if you just go to our website and find our menstrual health page, which is not linked here, you would have to Google JMP menstrual health. You would find access to these reports. We also have a session that Marnie is leading later in the week on new measures for menstrual health. I encourage you all to go to that. Thanks. Sorry for the rush.
Actually, if we really want to drive change, let's put gender and menstrual health first before water.
Oh, yes. Yep. It's a good point. Thanks also to our online participants. Have a great week, everyone.
Oh, yeah.
Hey, how you doing? Great job as always.
Call on you to give examples in the fire, but I was figuring Take on time.
Did you have any questions about how to look at an aggregate?
Oh, my gosh. Yes, we did some calculations, right afterwards, but, I think what happened is we just got caught up in other stuff. And honestly, I've been traveling for 2 weeks, so, I want to say that we didn't finish that up, but there's something you think you'll. Yeah, send me a reminder.
Okay.
And I'll, dig it up again.
And so do you have some time and distance for discussion? Do you have? Distance? Yeah. Time.
Yeah, a few visual aspects as well, but we don't feel that any important service. I would actually report once, I put it subjective. People are saying it takes them more than 30 minutes. I think that as a subjective.
I'll send you just a whole, anything specific you need in that.
No, just send the same.
Okay. Okay.
Yeah.
Thank you. Yeah, I think I'm gonna do a lot with it.
Yep. Okay. Thanks.
How you doing? Yes.
Hey, how's it going?
Excellent. I
Thank
really
you.
like